Thank you so much for joining us this afternoon. Those of you, well, feel free to sit wherever you like. You obviously are doing that, but if you felt like coming up to the front where the tables are, you are welcome to do that as well. So I am Jin Ha. I am the Executive Director at Social Planning Toronto, and I'm very pleased to welcome you all today to our community forum and launch of the report, Caring About Care Workers, Centering Immigrant Women Personal Support Workers in Toronto's Home Care Sector. So as I mentioned, I'm with Social Planning Toronto. We are a nonprofit charitable organization whose mission is to challenge inequity in our city through knowledge generation and research, debate and dialogue, civic engagement, advocacy, and collaboration to spark social and policy change. In our research and policy work, we strive to ground ourselves in the expertise of communities most impacted by unjust social and economic policies, and the organizations that work most closely with them. The work we want to share with you today connects lived expertise with systems-level research and policy analysis. We want to share our research with a wide audience and identify solutions that will build community power and lead to policy changes that improve the lives of those most marginalized. Before we begin, I'd like to start by acknowledging the land we are on today, also known as Tekaronto, and the current stewards of the land, the Mississaugas of the Credit First Nation. And we also acknowledge the historical relationships between the Wendat and the Haudenosaunee Confederacy, who have lived in this territory. And this land is also home to many Indigenous nations from across Turtle Island, including Inuit peoples and the Métis Nation. And Toronto is covered by Treaty 13 and the Williams Treaties. Many of us have come here as settlers, immigrants, or refugees in this or past generations. We also acknowledge those who came here involuntarily as a result of the transatlantic slave trade, and we pay tribute to those ancestors of African origin and descent. African peoples have been contributing to life on traditional Indigenous territories since the early 1600s, and we acknowledge that Indigenous sovereignty and Black liberation movements hold significant linkages then and to this day. I am a first-generation immigrant from South Korea. My ancestors, including my parents and grandparents, were impacted by war, imperialism, colonialism, and poverty. My family moved to Canada a couple of decades after the Korean War in search of more economic and social opportunities. My family would not have been able to immigrate to Canada under the current immigration rules. Throughout the 70s and 80s, we faced a lot of racism, but we also experienced a lot of privilege as settlers. In Canada, my mother worked in a factory putting together VCRs. I think maybe some of us in this room might not know what VCRs, I don't know, and other electronic equipment while raising 4 children. And when she was diagnosed with cancer in the late 90s, we became recipients of Ontario's home care services. Since then, I have gone through 2 additional rounds of home care services to ill or aging family members, and I have witnessed and experienced firsthand the incredible role that personal support workers play in our healthcare system. And even today, I would not be here with you if it were not for a personal support worker who visits our home every day to help take care of my elderly father. Henry? Henry, where are you? And he just happens to be here. I didn't even invite him, so it's so great to see you, Henry. What a small world. I intimately understand the value of personal support workers. I know it, I experience it every single day, and I think that in this room, I am not alone in this. So I'd like to ask all of you, by a show of hands, how many people here have received home care from a personal support worker or have family or friends who have? Wow, look at that. So many of us. So many of us know how important this work is and how important it is to talk about making improvements to the system, and particularly for personal support workers. And thank you, all the PSWs in this room that make such a difference in all our lives. We really appreciate you, and we see you. So we are so excited to be sharing with all of you our new research that centers the experiences of PSWs, namely immigrant and racialized women working in home care, and the critical role they play and the challenges they face, despite many gaps in Ontario's home healthcare system. So before we get started, I just wanted to quickly recognize the presence of MPP Jamie West from Sudbury. Thank you, Jamie, so much, and welcome. We understand how busy a day it is today at Queen's Park, so we really appreciate you prioritizing this event. Today's report launch, it's also a community forum, and moderating this community dialogue is my wonderful colleague, Stacia Stewart, who is the Director of Research, Policy, and Communications at Social Planning Toronto. Stacia.
You're going to see many of us many times this afternoon scoot around this around this pole to get here. Thank you, everyone, for coming. I'm delighted to be your moderator for this conversation today. We are here to discuss not only the findings from our research report, but also to dialogue about the lived realities of PSWs working in the home care sector and explore strategies and solutions that value this work and lead to better working conditions across the sector. Today, we will start with a presentation from our researchers, Beth Wilson and Dr. Naomi Lightman, about the research report. We will have presentations from Connie Ndlovu and Ella Tan from their experience working in the sector. And then we will have a question and answer period where the audience will have an opportunity to share comments or ask questions of the panel. So before we start the first presentation, I would just like to quickly read through the bios of who our presenters are so you know who you're going to be hearing from. Naomi Lightman is an associate professor of sociology at Toronto Metropolitan University. Her areas of research expertise include care work, migration, gender, and critical social policy. Her academic work has been published in a variety of peer-reviewed journals, and her research has been supported by 7 tri-council and institutional grants where she was principal investigator. She is the co-author of the 2nd edition of the textbook Social Policy in Canada. Dr. Lightman also actively collaborates on research with progressive social agencies, including Calgary Immigrant Women's Association, the Wellesley Institute, and Social Planning Toronto. Beth Wilson is a senior researcher with Social Planning Toronto. She has contributed to the research, policy, and advocacy work of our organization for more than 20 years. Beth's research and policy work has focused on a broad range of community and public policy issues, including income security, affordable housing, good jobs, food security, access to public and community services, and the municipal budget process and civic engagement. Ella Tan is a registered social worker who has been working with paid care providers for more than a decade. She focuses on challenges and trauma related to migration, particularly in the Canadian caregiver program. As the employment and family support worker at North York Community House, she supports the emotional well-being of paid workers, particularly newcomer women and their children, and has built a network of support agencies that serve them. Ella holds a position on the Advisory Council for the Canadian Centre for Caregiving Excellence, a nonprofit organization that supports caregivers and care providers and advocates for an effective social policy. Ella is leveraging her experience as a co-host of a podcast, Mom, Let's Talk, aimed at Filipino youth and mothers, fostering crucial conversations on family reunification and the challenges faced by immigrant Filipino women care providers in their pursuit of meaningful employment. She was a recipient of the Quincentennial Award from the Philippine Consulate General for her work dedicated to Filipino families. Connie Ndlovu is a Black woman who arrived in Canada as a refugee from South Africa. After securing her immigration status, she immediately pursued her education at George Brown College, successfully earning her personal support worker diploma. For more than 20 years, Connie has dedicated her career to home care, providing compassionate, dignified, and high-quality support to seniors, many of whom are among the most vulnerable in our communities. Like many home care PSWs, Connie is deeply concerned that decades of government underfunding have pushed Ontario's home care sector into a crisis. Without intentional investment and strong policy action, the system faces the risk of collapse. Chronic issues such as precarious employment, poverty-level wages, and poor working conditions have created significant challenges for recruiting and retaining workers. Currently, Connie serves as the president of CUPE Local 7797, where she continues to champion the rights of home care PSWs, workers who are predominantly Black and racialized immigrant women. In this role, she advocates tirelessly for fair wages, dignity in the workplace, and protection from precarious working conditions. Thank you for welcoming all of our panelists today. I would like to invite Naomi up to present, to be the first presenter on the research.
Thanks, Stacia. So I will be providing some details on our research project and key themes from our data. There we go. And then I will hand it over to Beth Wilson, who will speak about our case studies and policy recommendations. The Caring About Care Workers project is a collaboration between Social Planning Toronto and me, Naomi Lightman from Toronto Metropolitan University. Before we begin, we'd like to acknowledge our funders for this project, including SSHRC, the City of Toronto, and United Way Greater Toronto. As well, we'd like to note that we are deeply grateful to the PSW participants who generously shared their time and experiences with us. It is their voices that tell a powerful story of inequity and resilience in Toronto's home care system. This research was and is motivated by a broader understanding that home care, personal support work labor, is invisible to many people, as well as being economically and socially undervalued. Yet personal support workers are the backbone of Ontario's home care system, providing the majority of home care services. In 2022, an estimated 28,854 individuals were employed as PSWs in Ontario's home care sector. And in 2023, home care PSWs collectively provided 36.7 million hours of care to Ontarians through the provincially funded system. In home care, PSWs support clients with activities of daily living. They work with seniors, people with disabilities, and individuals recovering from a hospital stay. In terms of who is doing this work, it will be no surprise to anyone in this room, we know that it is immigrant and racialized women who are disproportionately represented among home care PSWs and comprise the majority of home care PSWs in the Greater Toronto Area. These skilled, knowledgeable, and dedicated women are impacted by a system that relies on their essential labor while also deeply undervaluing their work. Oops, sorry. So, our project's main objective is to contribute to our collective understanding of the experiences of immigrant women working as personal support workers in Toronto's home care sector, and specifically to highlight and amplify the lived experiences of these women and hear their perspectives on the most critical issues they face at work, as well as their suggestions for system reform. So rather than being purely descriptive, it was important for us to have a strong policy dimension to this work. Based on our in-depth interviews, we aim to provide specific recommendations to improve working conditions and build the collective power of home care PSWs. Our research methodology was guided by our objectives. Our top priority was to speak with immigrant women PSWs themselves. Participation in the study was open to PSWs who met the following criteria: identified as a woman, born outside of Canada, and worked as a PSW in home care in the City of Toronto during the COVID-19 pandemic. A goal of the research process was to engage a demographically diverse group of immigrant women with experiences in different employment settings. This objective was largely achieved. We conducted semi-structured interviews with 25 immigrant women PSWs from a broad array of backgrounds. We spoke to women from 12 different countries of origin who had come to Canada through a variety of immigrant entry classes and who had worked in both for-profit and not-for-profit agencies, as well as some who were self-employed and who were both unionized and non-unionized workers. In addition, we chose to speak with 7 organizational representatives from community agencies and labor unions who worked in areas connected to PSWs and home care. To assist with the recruitment of participants, we relied on Social Planning Toronto's extensive community and labor networks. Community organizations, nonprofit home care providers, unions representing PSWs and home care workers, and PSW networks were all instrumental to our outreach process. From our research, 4 key themes emerged. Our first theme is that PSWs are subsidizing Ontario's home care system with their unpaid labor. This is in an effort to provide clients with high-quality care and to cope with unmanageable demands on the job. Using their unpaid personal time, PSWs are working beyond their paid hours simply to provide adequate care to clients. And the powerful quote we have here from Connie and Ndlovu, who will be speaking later today, highlights this issue so well. She emphasizes that the hours of care provided by the care plan is simply not enough time for many clients, and that as a result, PSWs end up staying longer without pay. PSWs are on the front lines of people suffering, and they are aware of how the rationing of care is harming vulnerable clients. Their work is made unnecessarily stressful due to the inadequate allocation of care services. This quote is from another woman discussing how she used her unpaid personal time to care for clients. She said, "If I have many clients and I only have 15 to 30-minute gaps, I will start early in the morning. If my client is at 9 o'clock, then I will call them and ask if I can come at 8:30 to avoid stress, because if I will be late, I will be the one that will suffer anyway." On this slide, sorry about that. Participants also described the stress they experience as the result of rationing of home care services. They explain how they use their unpaid personal time to cope with these conditions, arriving at clients before they're on the clock. This participant says, "There's a client of mine who really declined. He had a fall one day, and then he's in bed and can't move at all. I am the only one supposed to see him. I am only supposed to see him once a day, but as I go into the building, I have to see him more than once because he really needed help. Really, really. I have to just pop in, help him, move along, pop in each time, help him, and move along. It's really hard to see these people in a certain state, even though you know you're not really being paid." Our second theme is that the provincial home care system offloads costs onto personal support workers. Precarious employment is widespread in the home care sector, and this is well documented in existing research and literature. Our research participants just explained to us that they receive low or no pay for their travel time. They are not fully reimbursed for travel costs, and they often experience long gaps of unpaid time between client visits. PSWs also routinely have their work hours reduced and lose hours when clients move, enter hospital or long-term care homes, or pass away. And these unfair working conditions are due in large part to insufficient funding and an inequitable funding model based on a standard hourly rate for personal support services. On this slide, we have two examples of women who told us about how they were financially penalized at work due to circumstances well beyond their control. The first is from a woman who contracted a respiratory disease from a client, and the second is from a woman who lost her caseload when clients passed away. In both cases, they suffered financially. Our third key theme is that home care PSWs face serious health and safety risks. During the course of the interviews, many health and safety concerns were raised by home care PSWs, often tied to working alone in private homes without any on-site assistance. Participants conveyed that they deeply value their relationships with clients, and they see their clients as among their most important allies. Yet they also discussed cases of traumatic experiences with clients where they were subjected to anti-Black racism, sexism, violence, and harassment. Some participants also detailed injuries incurred on the job, as well as negative mental and physical impacts of working through the COVID-19 pandemic. As a participant so aptly summarizes here, you're providing support for other people's health, while your health as a worker is not supported. On this slide, we have two very troubling examples of Black women who described extremely distressing experiences with racist clients. In the first case, no workplace supports, debriefing, or counseling were provided after this traumatic experience on the job. In the second scenario, after reporting the incident, the participant's supervisor asked her to continue working for the same client for 2 more weeks. She declined, yet this request was particularly troubling given the intimate nature of care work. And unfortunately, this type of situation was a common occurrence for many Black women on the job. PSWs also provide home care to many clients with dementia and related conditions. Participants reported experiencing assault and abuse by some clients with these complex health issues. For example, in the quote here, our participant spoke about an experience with an aggressive client. She stated, "My new client, he's very agitated. He's called me names, but I don't take it personally. If you're going to shower him, he's screaming. He'd call me names, he can hit you. But some of the people don't understand that the disease is not him. But on the other hand, I have to protect myself." Personal support work, perhaps by its very nature, is physically demanding work that carries the risk of physical injury, and workers are most vulnerable in private homes. Yet when home care PSWs are injured and must take time off work, many lack sufficient paid sick time and extended health benefits. As an independent agency of the provincial government, the WSIB is tasked with supporting the recovery of workers who incur work-related injuries and illness. However, studies of injured workers have identified significant problems with the WSIB, And this was the case for some participants in our study, such as the woman quoted on the slide. On top of all of this, healthcare workers had an increased likelihood of contracting COVID-19 during the pandemic. Many became ill, and several died. PSWs risked much to provide care to clients in the community, as we can see from this quote. Our fourth theme highlights that low wages, precarious employment, and poor working conditions drive home care labor shortages with grave consequences for Ontarians. As a result of these poor working conditions, staff retention is a key problem in home care. Notably, the provincial government has projected that by 2032, an additional 50,853 PSWs will be needed across all sectors. Yet nothing is being done to retain PSWs in home care. Our participants identified the major contributors to staff retention problems as being a lack of guaranteed work hours, inadequate work hours, low wages, and a lack of wage parity for PSWs across sectors. As the second participant here notes, people are leaving home care and going to long-term care because they pay them more, and the hours are guaranteed. We are all providing care, whether it's in the home or it's in long-term care. Why is there wage discrimination? When home care is not available, people turn to more costly forms of care: hospitals, emergency departments, and long-term care homes, which we know have higher costs for the system as a whole. And the final quote I'll present here today highlights how the staffing crisis is impacting home care clients. This participant stated, "There are not enough workers to actually work as needed. I don't work on weekends anymore. The clients I had, they complained. There are some clients that you attend to twice a week, and some need care every day. So those that I work with every day, sometimes when I go back to them on Mondays, they say, 'No one came on the weekend. No one visited.' There are not enough workers to go around and help those clients, and sometimes they are deprived of care. The failure of the provincial home care system to ensure stable employment, guaranteed and adequate hours, and fair compensation for PSWs is driving the staffing crisis. And home care clients are paying the price through a lack of access to care with risks to their health and lives. The continued undervaluation of PSWs in home care will limit the ability of many to age in place. It will put greater pressure on the broader health system and present grim consequences for the health, well-being, and lives of Ontarians in need of care." And now I'll turn it over to Beth.
Thank you so much, Naomi. Thanks everyone for coming today. I'm going to speak to our 3 case studies from the report, and they provide a broader context for understanding the working conditions of home care PSWs. So the first case study, Privatization and Profit in Ontario's Publicly Funded Home Care System, this case study traces the origins of the current home care crisis back to major provincial reforms of the late 1990s. In 1997, the Ontario government, under the Progressive Conservatives and then Premier Mike Harris, privatized the delivery of home care services and opened up service delivery to for-profit home care companies. Privatization and competitive bidding destabilized the home care system with widespread precarious employment, decline in wages, worsening of working conditions in home care for home care workers, and loss of continuity of care and compromised care for home care recipients. Large for-profit companies offered lower bids by providing workers with lower wages and precarious employment. This process pushed out many nonprofit organizations. It also resulted in the loss of better compensated unionized positions within home care. Contract flipping, where a service provider organization lost a contract, another one won the contract, then they would lose it, another one would win. It produced these ongoing waves of widespread layoffs, and many home care workers left the sector. It created ongoing labor shortages that continue to this day. Women who comprise the majority of paid and unpaid caregivers and the majority of home care clients were deeply and disproportionately impacted, including the many immigrant and racialized women working in home care. Despite subsequent government reforms to remove the worst aspects of managed competition, profit in publicly funded home care has been maintained, and widespread precarious employment is still the norm. Our second case study, The Future of Ontario's Publicly Funded Home Care System, examines the potential of a public nonprofit home care system to replace the current privatized one. Shout out to Ontario Health Coalition as great defenders of our public health system. They have long called for a public nonprofit home care system and offered a vision of that system, one that is comprehensive, accessible, needs-based, standards-based, and enforceable, integrated into a continuum of care, democratically and locally governed, and accountable to communities served, and operated under commitments to equity, diversity, and public transparency. It is a remarkable vision for home care and not the system that we have today. In Ontario, most publicly funded home care services are delivered through large for-profit companies, and we might ask the question, how much public funding for home care goes to private profit? The answer is we don't know. We should know, but we don't know what the total is. There is a lack of public transparency in the home care system, and most large for-profit home care companies are privately owned, and they have no obligation to publicly report profits or other financial information, even though they receive so much public funding. However, there is some data, and that data tells us that at a minimum, tens of millions of taxpayer dollars are diverted into profits for the benefit of the few. There was a 2015 report by the Ontario Auditor General that reported 5% of public home care funds are retained for profit. And that at the time amounted to almost $75 million. However, the Auditor General was quite quick to say these were self-reported numbers. They were self-reported by home care companies. And the Auditor General did not have and does not have the legal authority to verify those figures. So that's one source of information. I'm going to share a second source of information about profit in care work, and that is from Extendicare. Extendicare's operations give us a glimpse into the profitability of publicly funded home care. It is a $1.4 billion corporation, and it's traded on the stock exchange. And because it's traded on the stock exchange, there is some legal requirements to publicly disclose some financial information. ParaMed is the home health care arm of Extendicare. So it's a subsidiary company of Extendicare. And Extendicare also has long-term care homes and also has consulting services as its two other core businesses. In 2024, Extendicare had over $566 million in revenue from home health care. And the great majority of that came from contracts with the provincial government, so Ontario Health at Home. The net operating income was over $62 million. And that's revenue after expenses, which represented 11.1% of their total revenue from home healthcare services. So it's a measure of profitability much higher than that 5% that was reported in the Auditor General's report. Extendicare has paid out its shareholders around $40 million annually in dividends between 2022 and 2024, and they are making payments this year as well. And of course, their profits from their 3 core businesses, including home healthcare, are funding those dividend payments to shareholders. Extendicare reports also show that the profitability of their home healthcare business has been increasing over time. And they also document lavish compensation for its senior executives, and we know that is not the compensation in the nonprofit sector. That is not the compensation in the public service either. So from our point of view, this is a wasteful use of public funds where every public dollar, every taxpayer dollar should be invested in high quality care for Ontarians and good jobs for workers who provide that care. Our case study concludes looking at the potential of home care worker co-ops within a public nonprofit system. So really the polar opposite of an Extendicare. We recognize the potential of worker co-ops to improve wages and working conditions, center the concerns of workers, and deliver high-quality care. It is notable to say that no employment model can overcome the deep deficiencies in the home care system. So while we support the development of worker co-ops within a public nonprofit system, it is alongside the need for major transformation of the provincial home care system. Case study 3, the role of unions in improving PSW working conditions and building workers' collective power. And this case study highlights an organizational interview with home care PSW and labor leader Connie Ndlovu, who we're so fortunate to have with us today. So I'm not going to speak to that interview because you are going to hear directly from Connie today. I want to share just a couple of observations from our research regarding unions. In our interviews with home care PSWs working in non-unionized places, we noted this extra layer of exploitation impacting these workers. So for example, one PSW told us that her employer hired new PSWs and paid them at a higher rate than the PSWs who were very experienced and had been with the company for a long time. Those workers had no collective agreement, of course, to fall back on that might have provided some protections. And no grievance process, no recourse to challenge the decision so that the existing staff could be paid fairly and paid more than their current rates. There were also real and very understandable fears of workplace reprisals if people spoke up. They worried their hours might be cut, and as precarious workers, they were very vulnerable. In another situation, a participant told us that their employer cut off home care workers' travel stipends mid-year, really out of the blue, suddenly offloading the full cost of travel onto home care workers. We did not meet any home care workers who had their travel fully compensated, but even the funding, the amount of funding that was provided to offset some of those costs was suddenly just gone. And again, very difficult situation to challenge that kind of injustice within the workplace. So I'll leave that at that for case study 3 and really encourage people to read the interview we did with Connie, which is fantastic. Learned so much from her. I will now speak to our key recommendations, and they were informed by our interviews with home care PSWs, and I'd like to share some quotes from these incredible workers. Definitely, we need more job security, and we need more time. Whoever is funding the services to extend the time for the clients, to give the proper care to the client, and also to avoid all the stress and the burnout for us. I told my superiors that, to keep your employees, you should give them benefits, retirement, pension, and what other companies are giving. They said they couldn't afford the benefits, but I think they should. It should be uniform. And another participant told us, I believe the government should really look into paying PSWs more than they are because the work is difficult. The wage does not compensate for what we have to do. The cost of living is going up, but the wages are not going up. With the traveling time that we spend on the road, I believe that we should be compensated for the time spent. And many of their comments reflected in our 3 key recommendations. The first one being ensure fair compensation, secure employment, and protections for home care PSWs. And we call on the provincial government to achieve wage parity for PSWs across sectors, to ensure guaranteed and reliable work hours, full compensation for all work hours, including travel time, access to employment benefits, protections to support the health and safety of home care PSWs, and we call for a sectoral strategy to protect workers from anti-Black racism and other forms of discrimination in home care. We also have recommendations that address concerns of injured workers, about pandemic readiness, and organizational strategies to address racism and discrimination in home care. Our second key recommendation is to transform Ontario's home care system to support good working conditions for PSWs and high-quality care for Ontarians, and it focuses on transformational systems change at the provincial level. We recommend the creation of a public nonprofit home care system, joining our voices with public health advocates, an end to profit in the publicly funded system, adoption of a grant-based funding model to support the full cost of care provision, development of employment standards, and improvement of public transparency and accountability in home care. And we also speak to the federal government's role to list home care as an insured service, to tie funding to system improvements, and to develop national home care standards. And our third key recommendation is to build the collective power of home care PSWs. We call for the provincial government to reform labor laws to improve access and reduce barriers to unionization for home care PSWs, for the labor movement to dedicate more resources to organizing with home care PSWs, and for the community sector to support PSW networks and leadership development opportunities for home care PSWs. And finally, we also support worker rights campaigns, solution-focused research, and workforce development practices to promote decent work in home care, and for senior orders of government to support worker co-op development as well. And I will leave it at that. Thank you.
Thank you. Thanks. Thank you. My name is Connie Ndlovu. I'm a home care PSW. I work in home care. I've worked in home care for over 20 years. And I'm also a president of CUPE Local 7797, which is a composite local, but first and foremost, also we deal with home care PSWs in this local. I thank Social Planning Toronto for including me in this our project, which is very, very important. We've had their report, we've had the findings, the data is there now. We've also heard the recommendations, but I'll speak from the point of labor. And why I speak from the point of labor, 20 years ago when I started working at Spring Senior Care, I was very lucky because I was working in a unionized environment, which made me know my rights as a worker in home care, which made me be able to tell my supervisor about what was happening to me in home care, which also made my union to bargain fair wages for me, but also have very little benefits because the sector is very precarious, even if you're unionized. But then for those who are not unionized, those things are not existent. They have to work with the employer, get whatever they get. There's no sick time, there's no benefits. There's more exploitation. So it's very clear that home care workers who are in a union are protected, unlike those who are not in the union. Home care workers who are in a union, even if we make minimum wage, is better than those who are not in the union. So it is very important that the labor provide resources for these workers who are not unionized to be organized and be in the union. Because this is the only place where they would talk about their rights, where they can talk about exploitation, but above all, where they can refuse unsafe work, where we can hold the employer accountable. Because sometimes when we try to report these things where there's no union, the employer's hands are tied. Connie, the client has got dementia. But Connie, we can't afford to lose that client. You need to go back. But where there's a union, no, we file a grievance. So I think unions not only make lives better for workers, but they will make life better for home care workers. Why are we leaving these workers out? There's very few home care workers who are in the unions. So I ask labor in one of these recommendations to invest resources to organize these workers. They are people like us, and the work they do is very essential. I know firsthand what it means to go and help someone who is old, who is bedridden, who is in pain. I know. It's not easy work. But I also know what we have to go through in those homes. But I also know how labor can save our plight in home care. We can, when we're organized, we can all, with loud voices, talk about the precarious funding in home care. We can all go and talk to the politicians and say this sector is gonna be deleted if you do not fund the sector. It's not just for us to go and work there, it's people that we support. We have the training. We do the work that the other PSWs in long-term care do. Why are we treated this way? Why are we forgotten? Even during the pandemic, the unions were talking about PSWs in long-term care. They were not talking about PSWs in home care. We were the last ones to get PPEs. We were the last ones to get a proper screening tool for COVID. Some of our friends caught COVID. They got sick. Some remained with disabilities up to now, but some passed away. It's a sector that is forgotten. So with the labor organizing this sector, we will never be forgotten. We won't be heroes that are unsung. We will be the heroes that are known, not only when there's a pandemic. We have talked about these issues way before the pandemic. So I ask for labor, they have the resources. Put workers out there on the ground to organize those that are not organized. To organize the newcomers, who some of them, this is not their stepping stone work, it's the work they want to do like me. I've done it for over 20 years. Many people have worked in home care for even over 30 years. The industry has been precarious then. It continues to be like that. So I think when we organize teachers, we organize nurses, we organize long-term care PSWs, don't forget about these workers. Labor were asking you. You have the resources. You have the resources to go to Queenspark and talk to the government and say, no, every worker has to be organized in this province. Every worker has to be organized in this country. Because yes, our plight is in the hands of labor. Thank you.
Good afternoon, everyone. Thank you so much for making me part of this very important event that works towards meaningful solutions to improving the paid care work in Ontario. As an employment and family support worker, I have witnessed firsthand the challenges faced by personal support workers, by the caregivers, and the realities outlined in the study reflect exactly on my daily conversation and interaction with caregivers and personal support workers. A lot of times, some of my clients actually do not show up on their appointment with me. And so, common reason is that if a member of the family of the client or another personal support workers on shift do not show up on time. So what happened is the personal support worker on duty will stay at least 30 minutes to an hour, and that's without pay. More often, they are also taking additional responsibilities, such as doing the laundry, washing dishes, and house cleaning. And it's not just simple light house cleaning. Sometimes they do general cleaning for their clients. And especially for PSW who transition from caregiver to PSW, it comes naturally with them, even if it does not include in the care plan. And I have heard stories of PSW who pay out of pocket for supplies, transportation, and trainings. And I've worked with PSW actually who have lost their jobs simply because they lack understanding, they lack knowledge and skills to understand the dementia-related behaviors such as verbal and physical aggression. And so even prior to the pandemic, we've received a lot of requests for additional trainings among personal support workers to help them understand how to support their clients living with dementia. And so as an organization, we collaborate with other organizations such as the Alzheimer's Society of Toronto so that these personal support workers can be provided with free trainings. And now we've recently referred them to their website so that they can directly register these free trainings. And not all the trainings are free. There are trainings that they have to pay minimal fee. But these free trainings are only free because the fundings are available. And sometimes it's not available. And sometimes, most of the time, it's not available. And for PSW working under temporary work permit, losing a job does not only affect their income, it also jeopardizes their immigration status in Canada. And this adds up an extra layer of pressure and vulnerability for workers who are already essential to our care system. Some personal support workers even spend at least $120 to renew their CPR certification, and that's from their own pocket. This amount is not, if you're getting a 17.50 minimum wage, 120 is a big amount for personal support workers. And so again, we partner, as per request by personal support workers, we partner with other agency to at least provide minimal fee for CPR certification, if not free. So again, funding is not always available for trainings. And trainings such as these are not optional. They're actually critical. With the right training and support, situation like job loss is preventable. And our PSW can feel better and better equipped in providing service to their clients. And as we head to the winter months, this becomes even more critical, especially for those without insurance coverage, as mentioned by Connie earlier. Many PSW find themselves running after buses late at night in the middle of the snowstorm, moving from one client to another. And these conditions are highly vulnerable to slips, fall, and injuries during travel, and while they are not compensated and protected. What is often unseen, and a lot of people do not know, is the immigration pathway through which portion of PSW in Canada, arrived in Canada. Well, I have worked with diverse population, like communities. 80 to 90% of my clients that are PSW, I support are Filipino women who came through caregiver or home care provider program, immigration programs. Many are internationally educated nurses with strong clinical backgrounds. However, restrictive work permit conditions prevent them from upgrading their credential or pursuing bridging programs needed to return to their profession. And by the time that they become eligible to reunite with their families, they're often financially and mentally exhausted, carrying years of isolation, economic hardship, and emotional strain. And as a result, many remain in PSW roles not as out of choice, but out of necessity. Accepting low wages, precarious work, difficult condition while supporting their newly arrived loved ones, and repaying substantial debts from immigration fees, recruitment fees, and the high cost of living. These systemic pressures directly impact our personal support workers, mental health, financial stability, and overall well-being. So let us not forget that the well-being of our personal support workers is inseparable to the well-being of their clients of which they serve. This is why to push for policy change, such as improving wages, stabilizing hours, and providing paid travel time, and guaranteed safe working conditions are foundational steps to retaining skilled workers and restoring the dignity of this profession. And beyond individual reforms, when workers are respected, when workers, PSWs, are protected and fairly compensated, clients receive safer, more consistent, and more compassionate care. And if we want a sustainable home care system that truly meets the need of our community, investing in PSWs, investing in our healthcare system is the only way path forward. Thank you.
Thank you so much, Naomi and Beth, Connie and Ella. You have painted such a beautiful picture of not only what this research has been about, but also what is important about what workers need and what workers have said. And what strikes me the most with this piece of research has been the care that you have taken to make sure that PSW workers in the home care sector and that their voices have been centralized within this research. There's a lot of care and there's a lot of love in it. I encourage all of you, if you haven't seen it, there's copies of the report out at the front. There's some here on some of the tables. Those of you who have the time, there's actually an executive summary as well in here, like a shortened version of the research. Really take a look at it. I feel like for myself, reading some of the interviews, particularly the case studies, really informative. You really can learn a lot, and it's there's a lot of care in it. So thank you all for that. So we are ready to start the question and answer period of the forum. We have a couple of questions, and then we will open it up for those of you who have questions yourselves to ask of the panelists. So my first question here that we have is directed for you, Connie, but please, anybody who has more to add, please do that. And I actually feel like, Connie, you've addressed some of this, so I've got more questions, don't worry. But the first question is, we've heard about wage parity, health and safety, discrimination and racism, and many overlapping issues that impact the working conditions and experiences of PSW working in home care. Can you talk a little bit about how these intersect and what happens if we don't address them together? That should be on, I think.
Okay, thank you for the question. Yeah, we often talk about, wage parity, health and safety, poor working conditions for personal support workers in home care. But when it comes to Black, racialized and immigrant women working in home care, these issues don't show up separately. They overlap every day. And because they intersect, they need to be fixed or solved together. There's no one single fix. For example, a worker who is experiencing racism is also a worker who is experiencing low wages, precarious work, poor working conditions, and so on. You can create safety rules, but that doesn't close the wage gap, which means that fixing one problem, actually ignoring other problems here, it will just continue the circle of inequality. Because these issues, they reinforce each other. They intersect. But also, if we don't solve these issues together or address them together, we create a society where we're going to normalize exploitation of home care workers who are predominantly Black, racialized, immigrant women coming from marginalized communities. We will normalize racism. We will normalize low wages in that sector. They will juggle multiple jobs because of precarity in home care sector. They will burn out. Their injuries won't be treated. They will be harmed, emotional and psychological. But not only them, including the clients that rely on these workers. You can close the wage gap, but you cannot ignore their experiences of health and safety, where they work in very unsanitary conditions. But sometimes, like I said, they deal with clients who have got dementia, or some are just plain, abusive and violent. They are punched. They are called slurs. They are treated like people who don't deserve any respect. So I worry about a single fix. I worry that when you give the $3 wage adjustment for home care PSWs, you think you have actually fixed the problem in home care. When these overlapping intersecting identities continue and they're not addressed together, home care is going to continue being unstable. Home care is going to collapse. The workers are tired. They are injured. Some of them are in wheelchairs. Some of them are carrying trauma of racism. So a single approach is dangerous if we want to fix home care. A holistic approach is ideal. As we've talked about the recommendations today, we've talked about everybody playing a part, including labor. But what's going to be more important in that holistic approach is the voices, our voices, being at that table where decisions are made. We are not just telling stories, we are telling you the real lives we live. And it's very important to really recognize the identities in the sector that do the work. Like I say, these issues don't just show up separately. To me, they show up together. They overlap every day. I might work 1 hour, be sexually abused. Don't report to the employer because I'm going to lose that 1 hour. That 1 hour might sound like it's only an hour. To me, it's income. But also, we might close the wage parity and pay all PSWs the same, like, the long-term care, because really the training is the same, and the care work that you do is essential. It's often the same. But we need to address these issues together. We need to find a solution for them together. And then we will have a stable home care sector where the workers like me are respected, where the workers like me are treated with dignity, where the workers like those sitting at the table there, Henry, are recognized and they are compensated fairly for the work that they do, because it is essential work. Thank you.
Thank you, Connie. I wanted to say thank you for using the phrase holistic approach, because I know that across different sectors, we often talk about how the community and the workers already know the solutions. And that is what you just described, is that if we had workers at the table who are leading these conversations and able to have access to those who make decisions that impact across the province, we would be talking about different things, right? This is one of those pieces where access and being at the table to have the conversation makes all the difference. So thank you for highlighting that. Do any other panelists have anything you want to add or say? Nope. All right. Connie covered it. Yeah. Connie covered it. I have a question for you, Ella. So, from your perspective, what role do community organizations play? That's why I don't have my glasses on. Do community organizations play in highlighting PSW voices? And what more do you think should be done to strengthen that advocacy work?
Thank you so much, Stacia, for that question. Community organization has a very important role to play in amplifying the voices of our personal support workers. First, it's because we do have the safe spaces for personal support workers to tell their stories without having to fear of retaliation. And we can also leverage our platforms in providing education to the general public. Oh, so sorry. And so we can also leverage our platform in providing education to our policymaker, to the public, to the communities, and make them understand the actual situation on the ground and what is truly happening in our care work system. Our advocacy humanize the personal support workers' experience. And also, it is our opportunity to influence public, perception to the PSWs are, as what Connie said, they are essential professional and not just care providers. And so we have, for us as a community organization, by showing a collaboration and show of force to make all levels of our government accountable, and that we are willing to work with them collaboratively to push for policy change. Thank you.
Thank you, Ella. Thank you, Ella. Are there any questions that any of you in the audience would like to ask of any of our panelists? Andrew, can I take, oh, you're on it. And then there's one over here.
Bit of a cookie I have to finish. Last Saturday, oh, sorry. Oh, there we go.
Okay.
Last Saturday, there was a rally for the beginning of a campaign with the Workers' Action Center at 400 University, the infamous tower that does not enforce labor law. It was about wage theft. And they didn't really concentrate on any particular aspect of that, but certainly when you know you need an hour and a half with someone and you're paid for an hour, that's wage theft. And I have thought over the years, we need to improve the laws. But then you run into a government, Doug Ford, that does not enforce the laws. There's something like 90% reduction in violations of the employment standards. It went from, over 5,000 cases, 1,500 cases, I guess, per year, down to 150. It's not that employers are better, it's that they aren't enforcing the law. So I'm thinking that there's two prongs to this, is to point out how important it is. There's a question coming. It's important that we recognize the service provided by the PSWs. I remember one time I was on the TDC and there was something about PSWs. I said, what is that? And that was maybe 4 or 5 years ago. And now I know what it is for sure. And I realize it's sectors and everything else. So I'm wondering, does anyone have any ideas about, because anyone who actually reads this report is going to say, we got to do something. And I'm looking and saying, even if we get a government like the NDP in Ontario that would go and actually maybe write the laws that we need, we have to have some penalty for a government that doesn't enforce them. And it isn't just going to the ballot box for the next election when we're fighting Trump, so give us 80 seats again. So what does anyone here, and I've been a union member for over 50 years now, so I totally agree with everything you said, Connie, there. Anyway, what can be done, do you think, in terms of maybe like some massive campaign? I don't know how this would work, where we educate the public that this is a job, it's wage theft is being involved, we have a corrupt, provincial government. And do you think that, because even if we have the laws, the government doesn't always enforce them. So I'm wondering what your thoughts might be about how we get around this so we make the laws enforceable.
Thank you.
Thank you. I can try and answer that because you're talking about a campaign. I think we can do a campaign. Like, what does the community, play? What role do they play in this? And I think you said it very well. So it's some of those things where we have a massive campaign in Toronto here about home care and about the crisis in home care. There's, we've got the clients who rely on this service that we have to provide. And then you've got the workers who are burnout, who have no protection. So yeah, we need those voices from the community for us as workers. But also, sometimes we do have clients supporting us in this. So I think a campaign to amplify this report really, because it's put really concrete recommendations that can save home care sector, not just the workers themselves, but the sector itself. Because we also know that in long-term care, there's not sufficient beds for seniors to go to long-term care. They have a knee replacement today. They are going home before the end of the day. And if that home care PSW was not there to help them, just close your eyes and just imagine what will be happening there. But I love that question because also the community, I know that, during the pandemic, while we were wearing masks and worrying about the COVID, when they brought that $3 as wage enhancement, it was temporary. So we have some employers in the not-for-profit who do understand how complex issues are in home care, including how workers are treated. So we had a campaign during that time with Bills and Care, the CEO of TNG. So we worked together with the employer, but we were very lucky also to work with our clients to say, this is not wage enhancement. This must be wage adjustment, and it must be permanent. We did that during the pandemic. And, they said, okay, whatever it is, no, it's over, this and that. But eventually, it was made permanent. It was PSWs from TNG and Sprint that did that campaign with the community. Because we work in the community, you know what we do. So those community voices, those community campaigns are very, very important to carry this report. Because I believe that if we push this report and it's known, and we talk about it, we campaign about it, we will see change.
Thank you, Connie. And yeah, please go ahead, Naomi.
I'll just add to that. I certainly can't answer.
Is that on?
I don't think so.
It's on? Okay.
Maybe it's on now. I certainly can't answer your question fully in terms of how are we going to make decision makers actually do the things that they say they're going to do. But I would note that I think that it's not just a lack of information. I think it's that people in power have a vested interest in the status quo. Something that really struck Beth and I when we were writing this report is that we couldn't get any numbers. There's no data out there. I mean, the data that's there, we have in this report, but we wanted to know, what are the profits that are being, accumulated by for-profit providers? What proportion of these workers are not unionized? How much unpaid labor is actually happening? And that data is not available, and there's a reason for that. So one piece of the puzzle, in addition to hearing the voices of these workers, that's so important, we also, I don't know how, but we need to have more transparency in terms of what is going on right now. We need more numbers, we need more data to really show how unfair the status quo is.
Thank you, Naomi. Beth?
Sorry.
Yeah, that's okay. Thank you. That's fantastic in terms of the kind of community organizing, the role of labor, the role of research in helping to amplify what the issues are and expose the pieces that are invisible to people. I think people don't think about profit in home care because the profit is coming through tax dollars as opposed to reaching into your pocket. Now that's happening too in private care, but when you think about the publicly funded system, I don't think people think about that. And greater exposure, more attention through campaigns, the use of media, I think all that's really, important. And I think there's great knowledge, great expertise in the room where, what would a campaign look like? So I'm very interested in that. I agree with the points Connie's made about clients as strong allies, it's powerful. So there's something there to build on, absolutely. One thing I'll say is our current system, despite, like changes here and there over the years, the worst, very worst of what was introduced in 1997, has been reduced a bit, but like just such huge injustices in this system. And I would say that's been maintained by successive governments over and over and over again. So there's the government of the day and what their position is, and making that perfectly clear of what that means for families, what that means for home care recipients, what that means for workers. But I also look at the opposition parties. Where do you stand on any of this? Where, and really challenging them on what they have maintained and what needs to be changed. And that would probably be a piece of informing campaign organizing as well. And then where's their weakness? Where are people vulnerable? And let's, be organizing in those communities and make it real difficult, because the government of the day and others, governments of the day in the past, it's not like they didn't know these things.
Thank you, Beth. Actually, Jen, there's one question who's been waiting for a little bit of time over here. And then also, I see you there as well. Thank you.
So, good afternoon, everybody. So my question is here that I was a little bit late, so I couldn't see all the information that's in the research. So I actually work with the communities through City Crisis Committee, like most of the mental health and all other vulnerable situations that have people been facing as a community-based researcher. So my question here is, I saw personally, right, when I am working with the city for the mental health people and dementia, that the PSWs, they have been serving in the home care, like in the buildings and the residential buildings and everything, and I'm a resident leader. So I saw that they face very violent situations, right? It's not only about the people who are dementia, but also the family members. Like it's an informal way of violence, like, talking very aggressively, things like that. But sometimes we take the excuse that it's a dementia and then she's behaving like that. But besides that, family members are like that too. So that's also a kind of, the situation that's been degenerating their own mental health problem, like the PSWs. Second question is that I heard that some of the, they are employed by the private companies, right? So besides OHIP, do they have been given also the group health insurance besides OHIP by the private companies? If not, then what should be the pathways? Taking into consideration the holistic approach of their mental health and well-being, what should be the pathways that how we can advocate and pursue that health insurance from the private companies, which is they are having millions of revenues and everything. In one of the slide I saw, BP and the CEO and the VPs at more than 2 million salary, right? But we don't have the complaint about the salary, but we have the persuasion towards the benefits and the well-being of the PSWs.
Thank you. Anybody on the panel want to respond to that?
Thank you so much for that.
It's on.
Thank you very much for that question. I think I mentioned that I can only speak in behalf of the PSWs that I work with. And I know Connie can support me on this, that PSWs are hired in different manners. Like most of the PSWs that I work with, they're hired through unemployment agencies. That is why an employment agency can collect up to $40 an hour, and the personal support worker can receive a minimum amount as $17.50 to $22 an hour. It really depends. And if you are hired from this employment agency, travel time, travel costs, and insurance is up to the personal support worker. And and I know that I mentioned as well that there are personal support workers that are came here under a caregiver program that are already permanent resident. But there was a time when personal support workers are also international student, which means they don't have, if they just arrive in Canada, they cannot use their OHIP in case they are, they met an accident or injury during travel time or during the they working as PSWs.
Okay, thank you. So I would just add on that, especially when you ask about the mental health, and this is a huge thing, and I think also it actually is covered under the precarity of the sector, the low wages, the lack of benefits, no sick time. So we're not even insured. We don't have benefits, right, to cover, issues like, you've got stress, you can stay home, mental health, and WSIB is a nightmare. A few years ago, they were going to cover psychological stress, but it's just a nightmare when it comes to home care. So yeah, many of us are struggling alone with no help at all.
Thank you both. There's one more question here.
Good evening, everybody. I don't have a question, but Connie, I'm a personal support worker. I'm from Downsview Long-Term Care. I'm SEIU Local 1 Healthcare member. I have to read because I'm a personal support worker, Vado Data Labura. Before, I have experienced 12 to 10 made of houses. $12, it turned down to $10. And when I was collecting, I was saying, why my money is $10? And they said, my agency told me the employer who I brought you with only paid $10. From the $10 I received, I have to pay my own taxes, personal taxes. Nothing is left for me. I've experienced those. My employer, I have been there for about 19 years now. They heard us. My coworker down there, she goes to work, and there's another individual, it's double. Collective agreement, we are eligible for 4 hours. And the employer heard us. She stayed there for 8 hours. So whatever you're saying, someone is hearing you. But nowadays, I've noticed there is a feud about ranking autumn. It's a minor and major authorization. That's what we have to do first, solve before what we are talking about now. It's not something new. We are here before in this kind of arena. So it's only for me, as a personal support worker, Downsview Long-Term Care, GEM, it's only foreseeable if you are physically there as a personal support worker. And I've experienced, there's no display. Let me turn the page. The progress of what we are talking about at my company, my employer is not the utmost. There's always a bottom. A bottom meaning there's always a better one. They're not the utmost, but they're always hearing us. They're always working for progress, and they're always looking after who's the least person and not the most person. They are hearing us. So I'm here today. I'm a personal worker. I'm not supposed to be here. It's just because the courtesy of the president of Toronto York Labor Council, the president, Her Eminent, Lorraine, Andrea Babington, apology. So that's why I'm here, and I know I'm allowed to be here. So thank you for giving me the opportunity and the chance to speak today. I have no question because that will only alleviate what we are talking about. Thank you, guys.
Thank you so much. I would like to ask Jin to come back up and give us some closing remarks. Thank you, everyone, for all of your questions. And thank you also to the panel. Did we miss someone? Okay. So, do you want to give one more question? Okay, we're going to put in one more question. And then we will wrap up. And just so you know, we'll be, as we close out after your question, we will all be here for a few more minutes. I know that there's probably more to say. Obviously, there's more to say, and there's definitely more to do. But we'll have our last question. And if you want to come and speak to any of us while we're here, please know you can do that.
Hi, everyone. I'm Bill Sinclair with the Neighborhood Group, and some of our PSWs are here as well. And some had to leave because that's the nature of our work. But I did want to say that the report is alarming. And I wonder if we want to change the cover to like fire engine red and say that we are in trouble and that we are nowhere going to reach our 2030 target for the amount of care that's provided and needed, that we are losing our personal support workers as quickly as we are training them and gaining them, and we will never achieve the goal of 50,000 more that we need in the next 5 years. And that hospital CEOs need to step up and say, this is a crisis for the hospital, and it's not a secret, and it's right in front of us, because who can we get around our table that will be listened to? So I know it's in the hands of Social Planning Council now, but we need to get like a powerful table together to say this is urgent.
Thank you, Bill. Jin, the question was actually up here. Oh. Sorry about that. Where? That's okay, Bill. We've got room for both of you. Absolutely.
My question is like earlier Connie mentioned about racism. I'm PSW. I faced racism during COVID time. It was like I went a client house. He's not receiving me many times. And one day he needs me, but he said, I don't need Negro people. And no nigger in this building living. Then I was crying. I said, could you please repeat it? And he said again. And then I said, I'm not giving you anything. And I called after hours. And then I was crying. But for me, still hurting me, because in that winter, in that stormy day, it was a stormy day, no bus. I have to walk all the way there and receive this. My question is, like, what is the employer support how they support the PSW, except moving from the client? That's what I get. I didn't get any support. And how it can be for the person is hurting, still is hurting me, because I didn't get support.
Thank you. Do you...
Thank you, my sister, and I'm very sorry. Really, I am. If that can make you feel any different, I'm really sorry. We don't deserve to be treated that way. It does hurt, and this is the trauma we carry on our own. The employer is very dismissive. And yes, they will assign somebody else, and you are losing that 1 hour. Because do you want to return? Well, if you don't want to go, Connie, we'll send someone else. Or no, Connie, well, we're sorry, but you know what, the client has got dementia. No, that's not an excuse. That's not an excuse. Violence is not part of the job. We need, and we demand to be respected. We are human beings above all. And where there are unions, we will file a grievance, but it's still whether it's an apology. It does not take away the trauma that you have to carry every day. As you say that it was during one of the worst weather conditions, and you walk in and this is what someone tells you. There's no excuse for that. And I wish the employer could be more supportive. And why I also like this report is that it does touch on racism, anti-Black racism. And I don't know, I don't read a lot, but I think it's one of the first reports that has spoken to people about this. Because I agree, even the policies, they seem to be very racial when it comes to home care because of the people who work there in home care. There's no support. And you're right, even during the pandemic, as I said, we're the last people to get vaccines, we're the last people to get proper N95 masks. But also what happened when they shut the whole city down, we had no washrooms to use during the pandemic. They forgot about us completely. That there's these PSWs who are waiting in the subway to be called because we've got all these long gaps, right? But we had nowhere to go to the washroom. The parks, they put the yellow tapes, we had nowhere to sit. The malls were closed, and it was winter. So that's all part of that, racism. Like, you're not so, you forget about other people because they look a certain way. I wish the employers could understand the trauma that we have to carry every day is when we do this work. And I'm glad you reported, but sometimes these things we don't report them because we lose hours. When we lose hours, we lose income. When you lose income, we've got no food to put on the table for our children. We can't pay our rent. But it's abuse that is not acceptable. And I'm really sorry.
Thank you, Connie. I
will be really quick, and
please.
It adds to what Connie has said, and I am so sorry for the experiences, and they're too common, right? And I would say, at the provincial level, this is the issues of racism and anti-Black racism in home care are nowhere at the provincial level to identify and say this is a really very serious health and safety matter, and we are going to sit down and work with PSWs, we're going to work with community organizations, and we are going to figure out how we are going to support people better in these situations. What does it look like to prevent and support people? It's like it's a non-issue to at that level, right? And this is the publicly funded home care system, so it should be. No one there's a right to refuse unsafe work on paper, right, in Ontario, but how do you refuse unsafe work when you're just going to lose income? And that seems like there is a funding model that can recognize people are going to need to refuse unsafe work, and they should not be penalized economically for it. So thank you.
Thank you, Beth. Thank you very much. And thank you as well for speaking, for sharing that. I too am very, very sorry. As Connie said, violence is not part of the job, and we are human beings above all else, and you should be treated better. So I am sorry as well. I'm going to close us out for today. I would like to let you all know that the report is on our website. And there's actually information about that out at the front desk. You could also welcome to take a paper copy of the report. I really would like to take this time to thank all of the PSWs who trusted the researchers with experiences, knowledge, and ideas that formed and really is the heart of this project. We also would like to very much thank Beth Wilson, Naomi Lightman, and Rika Agnes Castaneda, and the entire team at TMU who also supported this project. I would like to thank Connie and Ella for being here today, for sharing all of your knowledge, all of your wisdom and your experience. We have many, many organizations and community partners as well who supported this research, who shared their knowledge and who are part of the part of the case study interviews. And of course, our wonderful team at Social Planning Toronto who put all of this event together. You know, so much gratitude for all of you, especially for coming out today and for listening, for sharing, for hearing, and for being able to be here and talk to us and share with us about this important work. There's lots to do, and we know that, and we hope to continue to engage with all of you on advancing this work and making some real change. Thank you. Thank you for coming.